The mission of offsite care is to bring the best specialty care available to any patient anywhere. For example, if there's a patient in Willits, California who has a severe spine infection and they have no infectious disease specialist in that area, and I get a call, I see the patient by robotic telemetry, I arrange to get a very qualified infectious disease consultant to help out on this case, and they can keep the patient there and treat with antibiotics we can suggest, oversee, as opposed to having the patient transferred to San Francisco, which is about 150 miles away. So that our goal is to keep patients at home with specialty care as long as that's their best course. If the best course is to move the patient to a larger university center of excellence, we'll be the first to do it. But if in our judgment we can give good care at home using an intensivist and 6 subspecialists, we'll try to keep that patient at home in his or her hospital, in his or her intensive care unit, for we think the best available care.
Hi, I'm Jim Russell, the CEO of Palm Drive Hospital. I've been asked to speak to our hospital's mission. And in our hospital mission statement, it says that Palm Drive exists to deliver access to quality and compassionate health care. But for us, thanks to Dr. Good and the robotic telemetry-assisted ICU, what it really comes down to is that we exist to deliver time-sensitive access to critical care for our citizens. It's not an exaggeration to say that at least 3 of our citizens will be alive next year thanks to our robotic-assisted capability. These are patients that would not survive the extra 20 to 30 minutes it would take to get them to an urban hospital further to the east. Consequently, our motto, saving lives 24/7, is not a claim, it's a fact. And so we look forward to having the William Heberden Robotic School of Telemedicine here at the hospital in this coming year.
We've been on the books for 2 years and in hospital for 1 year. We started just about a year ago. In fact, we had an anniversary. We opened the intensive care unit in this hospital, which is the Palm Drive Hospital in Sebastopol, California, on July 6th, 2007. We had our anniversary. And we celebrated the anniversary with a meeting of the whole hospital staff. And we point out to the staff that the ICU, in opening July 6th of last year, has essentially saved the hospital $800,000. And we provided excellent care. And we actually think we've saved 5 people over the last year who wouldn't have made it otherwise because they were so ill if they'd have been in an ambulance going someplace else. Without the interventions that we were able to do here, we don't think they'd have survived. So we think we made a difference in terms of lives saved and in terms of monetary impact in terms of this hospital in Sebastopol.
Hi, my name's Lori Austin. I'm the Chief Operating Officer at Palm Drive Hospital. And I have been here since Dr. Good brought the robotic system to the hospital. And what that's done for us is it's allowed the local physicians to keep the patients locally. Beforehand, we would have had to have shipped them to a larger city or to one of the other facilities, and we would have lost access to their patients, would have lost access for the families to visit their patients. So the robotic telemetry system has brought the specialists to the hospital, specialists we would have never had available to us in the past. And with that, that's brought confidence to the local physicians in keeping their patients also, and the community's confidence level has grown quite a bit. We're able to bring a level of high-scale medicine to the hospital that has only been available in the large cities in the past. It has brought a mobility of these specialists to the various units. For example, in the past, we wouldn't have had any specialists, but now we have the specialists both to the med-surg units, to the ICU, and to the ER. Some of the other systems are fixed and they focus in just on one bed, but this, with the robot, is able to go anywhere. So for a smaller hospital, it's been much more functional and much more utilitarian in our needs. 1 year ago, we were looking to close the hospital, and by having the specialist available to us here, it's been able to allow us to stay open and to keep the patients within our facility. And as a matter of fact, we've had patients transferred to us because we've had the specialists available that nobody else did. It's been a great asset to us, both for the community and for the hospital and staying in business.
Hi, my name's Reese. I'm the Chief Nursing Officer here at Palm Drive Hospital. I'd just like to say a couple words about the nursing care that we deliver here with the help of the robot. You know, we all know that patients come to the hospital for nursing care, and Herb, the robot, has really revolutionized nursing care for patients. And our nurses have become very comfortable using the robot in the delivery of care. And one of the things that have really changed and impacted the nursing delivery here is the fact that we have the specialists available instantaneously for our patients when they need it. And in the old model, you might have to wait, you know, several hours and even sometimes a day or so, which delays the impact of the care for patients. Our nurses are very comfortable with the robot, and one thing we look forward to doing here at Palm Drive is showing future hospitals how you can integrate the robot into the care at the point of service. So to us here, for the nurses, Herb is not a robot. He embodies many different specialty services that helps us here.
Offsite care has been able to help patients and hospitals in these ways. The patients are helped because they get better care, and they can stay at home as long as it's safe to be at home and reasonable. The hospitals benefit because they have a census, and the census is the key to economic survival. But the hospitals also, in doing this, develop a sense of pride, develop a sense of adventure because they're doing something new. We are doing this as really a forerunner in the United States. I was at a conference in Santa Barbara for robotic telemetry 2 weeks ago, and what we're doing is really being done only in one other place in the United States, in Boise, Idaho. And we're doing it differently. And what we're trying to do is, I'll say uniquely American, we're trying to do this in such a way it'll pay for itself. I really don't depend upon grants, upon fees in general, and my goal is to make this economically self-standing so it can replicate with a certain profit and benefit, not being a burden to anybody, and that's my goal. Can you do this for me? Can you put your hands out, stretch them out like that in front of you, and hold them like you're going to stop a bus? Let me look at it a minute now. Let me back off here. Okay, now hold them on up there. That's good. Okay, now you've got a little bit of tremor, but you've lost the what's called asterixes or flapping you had yesterday. That's much better. Yesterday when I had you do this, your hands were going like this, back and forth. They're not now. That's good. You can put them on down. That's real good. Now, you've got a beautiful room there, don't you? Yeah, you can look outside at the Laguna de Santa Rosa, and you've got the VIP room. It's a nice place there. I do think you're getting a lot better. Now, Mom, do you have any questions of me?
No.
Or daughter, do you have any questions?
All of a sudden, everything's just fine and
Oh,
good. I mean, it's just going to be.
He's just doing better. Well, put it like this. You know, he runs some chronic renal insufficiency. And what happened when he came in the hospital this time with his flare of his chronic obstructive lung disease and a flare of his congestive heart failure, his chronic renal failure worsened. And we've got him on medications right now to try to get his kidneys better, and they are getting better. Cynthia's putting out how much urine per hour?
A little over 100 cc's an hour since 7 a.m.
That's good. Now the Bumix is down to 1 milligram.
1 milligram.
And he's getting dobutamine at 5 micrograms per kilogram minute?
I said the butamine's off. He's just on nitro at 90 mics per kilogram per minute.
Gotcha.
But we're titrating that actively.
For his blood pressure.
For his
Okay.
blood pressure.
We should check just to make sure which way the creatinine is going. At 6 o'clock this afternoon, let's say 1800, let's check a basic metabolic panel.
Okay.
Because I want to make sure that, because the creatinine is dropping. It's 5.3 today, 5.6 yesterday. And we just want to make sure it's heading the right direction. If not, we have to do some remedial steps.
Okay.
Okay? Cynthia, do you have any questions?
No, I don't.
And by the way, the family, you're very lucky to have Cynthia. She's a really experienced, excellent ICU nurse. The doctors are only as good as the nurses, and if the nurses are better, we give better care despite the doctors. So that's my feeling. In any case, folks, I'm going to take a retreat here. Nice to see you. And I'll see you personally tomorrow, sir. I'll be back on call.
Okay.
Goodbye. Yes, ma'am.
I did have one question.
You bet.
Yesterday, he wasn't doing too well,
That's correct.
and you said if the blood transfusions didn't work, that it might be.
Dialysis. But we're not talking dialysis today. It looks to me like he's going to escape dialysis, which is really good because that's one big intervention. Okay? Okay, so really PT is going to be working with him, getting him up, getting him stronger, and we'll see if we can get him off of these medications that require being in the intensive care unit and out either tomorrow or the next day. Okay? But he really has turned the corner, I think. Okay.
Thank you very much.
You bet. Goodbye, folks. Nice talk to you personally. Bye-bye. Let's go see the other patient. I think Marion's got the Zopanex inhaler. QID? TID?
TID?
Let's do a TID. Okay, because it'll last that long. And on this gentleman, go ahead and switch him over to the inhaler. Or excuse me, to the ambient breathing treatments, the Duaneb. Now, how much oxygen do you have him on?
40%?
That's good. Now, if he fails today, if the work of breathing gets too high, just put him back on assist control.
Okay.
Just like we did before. If he makes it, don't do it. But if he starts breathing faster than 30 a minute, he gets diaphoretic, looks like he's really getting a tachycardia, put him back on the ventilator.
Okay, great.
Now, he is infected. It may be a urinary tract infection, maybe cellulitis, but he's well covered with the vancomycin and gentamicin. He's fine. Now, is PT working with him, Marion?
Yes, they are.
Okay. Now, will he open his eyes when you stimulate him?
He hasn't this morning for me.
Okay. Rub his chest and see if he'll open his eyes. His eyes are opening. See that? That's positive. Okay? That's eye opening. It's a little bit, but that's good enough. That fits. See if he'll respond to pain. Take his, just take a fingernail, press on it, listen if he'll withdraw his hand. Now, Jose, you got to put more pressure in there. Just take a fingernail, and you have a pencil? Yeah, put on that. Now press on there. See if he withdraws. No, do it on the nail side. Do it on the other side. And just put pressure. Hold it like a bar and put pressure on the nail bed. See if he would, like that. That's it. Now press there. See him withdraw? He withdrew to pain. That's good.
And you'll be better thinking. When you go in renal failure, you tend to get confused. You were when you came in, but you're not now. I think you're sharp now. Don't you, Cynthia?
Oh, yeah.
He's doing real good.
He's doing real
Okay,
good.
sir. So what I'm going to do is we'll emphasize rehab with you, getting up, getting your strength. We'll check on the oxygen levels. Try to get you out of the ICU tomorrow. Try to get you home by about Monday. What do you think?
Oh boy, that sounds great.
Let's do it.
Okay.
Cynthia, you have any other suggestions?
No, I think he's doing really good. He's been up in this chair for an hour, and I think he looks great right now. It looks really
That's good. Okay, let's do it. Okay, sir. Well, listen, I'm going to bow out. Nice to see you. I'll see you in person tomorrow, okay?
All right. Thank you, doctor.
Okay, goodbye now.
Bye now.
Cynthia, Barbara, thank you.
Thank you, Dr. Good.